Good morning. Welcome. Thank you very much for joining us this morning. It's a very exciting day for myself and several of my colleagues, and we really appreciate you coming out to join us. My name is Rob McLean, and I work at Canada's International Development Research Centre, which is a funder of science and innovation in the Global South for the Global South. We have 5 offices around the world, and our headquarters are in Ottawa, Canada. I'm here today for a very, very exciting, meaningful experience for me. We are actually launching, so this is the official platforming of an incredibly important global initiative in climate and health research. Advancing Research for Climate and Health, or ARCH, which I hope is the only acronym we'll use a lot on stage today, but that's the one to remember. If there's one, it's ARCH, for Advancing Research for Climate and Health, which is a truly global platform of leading thinkers who are developing regional hubs to grant scientists the capacity to develop evidence we need at the nexus of climate and health. Importantly, the WHO estimates that 90% of the impacts of climate and health are being felt in the Global South. Importantly about this platform is that those 5 hubs are based and grounded in the Global South. And I think this is a critical opportunity for all of us to gain the knowledge we need to take on these truly global challenges that come with climate and health. I'll be moderating the session today, and we'll be lucky to call onto the stage shortly the leaders of each of those 5 Global South hubs. They'll talk a little bit about what they're doing in their region, and also talk about how they're connecting as a global program to bring what they're learning locally together at a global level. One of the, I think, kind of really nice benefits of this program is that there's another demonstration happening in the background. IDRC has been pleased and excited to work with the British government, the FCDO, to establish this program. And when we need evidence deeply on this topic of climate and health, it's really been inspiring for me to see how funders we can work together to prioritize, to be effective in the way we're making investments in this space. And it's been wonderful for IDRC to have a partner and for us to work together on this topic. And so I have the pleasure to call to stage a colleague of mine, Dave McConalogue, from the UK FCDO, who will say a few words of introduction before we get started with the main discussion. So Dave, please welcome and thank you very much.
Great. Well, it's really good to be here, and I think a really good audience as well, considering it's 9 a.m. on the third day. So thanks, and it's an indication of the growing interest in climate and health. So I'm just going to say a couple of words, and then let's get down to the real meat of why we're here today, which is to meet the hubs and really understand what it is they're doing and the work that they're advancing at incredible speed and pace. So, I mean, I'm probably speaking to the converted here, but the climate crisis is a health crisis. I think we know that, and as Dr. Tedros, DG of the WHO, pointed out a number of years ago, that climate change is the biggest threat to public health of the 21st century. Now, our data actually is better now than it was when he made that statement, but the impact is much gloomier. So this is a real thing for us, and it's really happening now. This isn't a future event. It will just get much worse in the future, but it's affecting people's lives in many of the countries that we work in at the current time. And the impacts aren't being felt equitably. We know those who've polluted the least will see the harshest impacts from this. It's the most vulnerable, it's the most marginalized, it's those with least resources, and particularly women and children, who'll feel the greatest impacts of this. But there is also hope Yeah, COP26, 99 countries made a commitment to build a climate-resilient and sustainable health sector. And they did that in a context, not of having enormous budgets to drive this through. They did it because it's important and because they're seeing the impacts from this. And we also know that the health sector is a key protective factor for the impact of climate change, both in terms of being able to sustain delivery of essential, life-saving basic services, but also as part of a coordinated multi-sectorial approach when we have big climate change-related events which happen. But also, we know that health sector, and particularly think about primary healthcare, has not been developed in a way to be resilient to climate change. And that continues to be the case to even today. So actually, when you need that response from the health sector most, actually it's likely to be compromised and potentially unavailable. But this is why we really need a climate and health research capacity, because it will tell us, one, what actually works in the system, what do we need to do, what's cost effective, what's affordable, and importantly, what's scalable in the context that we're working in. And actually, we have an example of this from where I've just come from. So I spent the last 4 years in Nigeria. I mean, if you ever get a chance to visit Nigeria, work in Nigeria, I'd highly, highly recommend it. It's the most complex, interesting, brilliant country you could think to be part of solutions within there. But we worked, the UK led a program which was developed with a consortium of partners, including World Bank, WHO, UNICEF, and others. And it was really to understand what is it that makes a health facility vulnerable to climate change, and then what are the interventions that you need to address this. Now, we knew when we were developing this that others had tried similar things, possibly not on the scale of the CRIBS program that we were doing, but this had been tried before. People had attempted to understand and deliver interventions to make health facilities more resilient to climate change. But ultimately, most of that knowledge and that research has been lost. And so we were starting again from first principles. And that was kind of frustrating. I mean, it was a great project to be involved with. But the frustration was we knew a lot of knowledge had already been generated from this. And this is why it's so critical to have dedicated research on climate and health, both to generate that evidence and knowledge, particularly with the practical interventions on the ground that a crisis needs us to focus on, but also to make sure that we are disseminating that research and that information so that others aren't having to reinvent the wheel as we did with the CRIBS program. So the UK is really proud to have partnered with IDRC on this program. And we feel it's really critical, both in terms of driving the generation of research in really critical areas on climate and change, on climate and health, but also, really importantly, and maybe more importantly, is to build the next cadre of researchers and then platforms that really deliver climate and health research moving forward. So look, I'll leave it here, but just to say thank you so much for being here and participating. And particularly, I'll stop now because I think what you really want to do is hear from the hubs and hear what the fantastic work that's been going on for the last year and the incredible progress being made and some of the plans they have to deliver this. So thank you very much. Back to you, Rob.
Thank you very much. So for the past 6 months, almost closer to a year now, but I've had the opportunity to be working closely with our hub directors to develop this global research platform. And it's been an incredible experience for me. And for the last year, we've built this infrastructure that we hope we can showcase today is available and is open. So if you're here as a researcher, if you're here as a policymaker looking for evidence to put into action, there are many openings that we hope we can tell you about today, how you can work with us. But one of the things that I've learned personally over that time is not only are these some of the luminaries in the field of climate and health on this earth, they're also all really good people. And it's been so nice to build those relationships with good people. So I'm going to call to the stage each of our directors of our regional hubs. And I will begin by asking Professor Tintin Su our director for our regional hub in climate and health research in Asia, to come to the stage. Tintin is based at Monash University, Malaysia. Next, I'll ask Professor David Olaya, who is the scientific director for our regional hub for Latin America and the Caribbean, based at Javeriana University, Colombia. I'll ask Professor Majordi, who's here from the American University of Beirut, who is the director of our Middle East and North Africa hub. Next, I'll ask Professor Frederick Atto Arma, who is the director for the West and Central Africa hub for ARCH, and is based at the African Association of Universities. Thank you, Frederick. And finally, I will ask my dear colleague, Dr. Martin Muchangi, the director of our East and Southern Africa hub, to join me on stage. Martin is based at AMREF Africa. Thank you, Martin. So thank you, colleagues. And I don't want to take too much time. They're waiting to hear from you. But I did just want to take the moment to say, I think there's something very powerful happening when we sit down finally on this stage and I see the whole world looking back. And it impresses upon me how important this is as a global challenge. Regional intricacy, but global connectivity is essential for the way we think about climate and our human health. But what I'd like to ask now is that we just take a brief moment to introduce the work you're doing in your regions. And so, Tintin, I think I'd love if you could go first and tell us about the work you're doing in Asia. Thank you.
Thank you. Thank you, Rob. And good morning. And good mornings to see everyone's 9 a.m. in this room. And it's also thank you, sittings, or audience in this side, because I feel a little bit comfortable sitting some people at the back. But nice. Thank you so much for a very nice introduction, Rob. So I'm going to start talking a little bit about Southeast and Southeast Asia. Actually, South Asia and Southeast Asia is a home for 2.5 billion population. So that means, 30% of global population live in South and Southeast Asia. And we have a diverse geographical diversity. So we have a tropical rainforest, and then we have extensive coastal line, and then one largest island chains are in our region. For example, Indonesia, 17,000 islands, and then Philippines, 7,000 islands. And many of the countries in Southeast and South Asia are also very vulnerable to the climate change. And heat, increasing temperature, and the air pollutions are our day-to-day challenges. And extreme weather events like a storm, cyclone, and flood, and extreme weather events like the extreme heat wave are also increasing. And the rising of the sea levels make threatening our lives and livelihood. So for example, very beautiful islands in Asia, Maldives is sinking. And then the mega city, Jakarta from Indonesia is also sinking. Actually, India, Bangladesh, Pakistan, Indonesia, the Philippines, and Vietnam are include in the top 10 countries which have frequent occurring in the disasters. And more than 60% of people in South Asia live in the rural area, and then they heavily rely on the agriculture. So that challenges make us to do immediate actions, regional cooperation, innovations, and then to find climate resilient solutions, for community and also for the health system. So thank you to Canada, IDRC, and UK FCDO with the generous support and then with the like-minded researchers from 3 institutes, Monash University, Malaysia, Sunway Center for Planetary Health, Sunway University, and Maldives National University, we form Regional Hub for Asia Climate Change and Health. We call it REACH. So this is an acronym I used the first time and the last time. We will be using ARCH. And we have a multidisciplinary researchers. I, by myself, I am a public health physician. And then we have a planetary health expertise. We have an environmental scientist. We have an anthropologist, civil engineer, and then digital health expertise. We, according to our acronyms REACH, we really want to reach the vulnerable population in the region, knowledge user, community of practice, and the policymakers. So that's our main intention. Of course, our region is too huge, and then the climate change challenges are everything. We have A to Z climate change resilience. So what are we going to do within 4 years of this funding period? We cannot take care of every issues. So we have to prioritize, what are the research priority we should be taking care immediately for first 4 years of regional hub establishment. We did the careful steps systematically, and then we did a scoping review of the published paper in the regions, and then we did a stakeholder survey, stakeholder interview, expert panel workshops, and consultation. Finally, we identified some area to focus under our Asian regional hub. So we decided to focus both community and health system at the same time. And once we do the scoping review, the interesting things, the paper published in our region, more than 95% focusing on observational study, cross-sectional study. It's just exposure and outcome, mainly air pollution, how air pollution affect in cardiovascular disease, how air pollution affect in COPD, asthma, so on and so forth. What we are lacking is that there is no solutions. There's very few solutions in the published paper. So we really want to fill that research gap. So we are going to support the researchers who want to do community-based heat adaptation interventions for the vulnerable community. And then disaster is also one of the hot topics in our region. So we want to take care of that issues in the community levels and then also health system level. We are going to improve disaster adaptation, disaster health literacy among the community. At the same time, we want to strengthen health systems in our region. So to become the disaster resilient health system, at least primary care facilities. If you go through a medical school, there is no curriculums on climate change and health in our medical curriculum. So we plan to develop climate literacy toolkits, for the healthcare workers, not only for the medical doctors, nurses, midwife, community volunteers, so on and so forth. This is also one of the agenda. And capacity building and sharing is also one of the agenda of our Asian regional hub. We want to do net zero health system, and then we plan to develop massive online open course. And then we will be using effectively the case studies, in the regions so that it will be connected. We also have a long-term plans, the long-term plans, I'm going to highlight in my second talk. So thank you so much, Rob. That's a brief introduction.
Thank you, Tintin. You make it sound so easy. But thank you. And what Tintin didn't mention is when she invited each of us to come to Kuala Lumpur for the first meeting we had together. And it was wonderful, the global spirit you brought to invite us all to visit you. I'll now ask Professor David Olaya to introduce the Latin American Caribbean Hub, please.
Thank you, Robert. And thank you everyone for being here, and good morning. So I want to introduce CLIMAS, which is the name of the Latin America and Caribbean Hub for Climate and Health. So our region is one of the most diverse in the world in terms of biologically, economically, even politically, and of course environmentally, but also is one of the most vulnerable. So we are facing complex problems in this intersection of climate and health in almost all of the big ecosystems, even in the whole territory, but mainly in the Amazon basin, which is very important, also in the Caribbean island, and in the Andean which is the mountains. So in these terms, in Climas, we want to bring researchers, policymakers, and very important, the community, in order to develop knowledge and create skills. And also we want to push the actions in order to do more resilient the health systems and the communities. And we have mainly 3 big challenges in the region. The first one is related to primary health care. In these terms, we know that the health system are unprepared for face these emergencies and outbreaks that are increasing due to the climate events, extreme events. Also, we have a gap in the training of the healthcare professionals, let's say the work health forces. The gaps are very important, and we want to help this in this topic. The second is the food security and rural livelihoods. So the agricultural production is facing problems due to the climate change. So the rural employment is also being affected for these reasons. And very important is the sustainability of agricultural practices. It's also very, very challenging in these terms of climate health. And all these situations have heavily impacts in terms of rural women and also in small farmers. So the third one is data and monitoring system. So we have a very, let's say, different levels of development in terms of data, in terms of infrastructure. Some countries are very good, some others, they have big problems with infrastructure and with data monitoring and collection. So this is a problem. Even with the countries which have a good infrastructure, they are struggling with trying to combine health data and environmental data, which is very important in order to establish some or to monitor or do surveillance in terms of climate and health. And the problem is that it affects the ability to preparedness. This is one of the most important things. So finally, we are going to respond to these challenges, not only studying these challenges, but also co-creating solutions with actors. This is our approach. And we have, of course, three main approaches. And the first one is strengthening capacity. So we want to create like shared training spaces among universities, health institutions, and communities. These 3 actors are very important. Also, we want to integrate climate and health topics in the preparedness of the primary healthcare professionals. So this is one of the more important issues. Also, we want to inform policy and promoting intersectional action. So we want to produce evidence and promote dialogues among all the actors. And then we want to focus especially in food security, gender equity, and rural livelihood. So finally, we want to build or to improve the data and surveillance for decision making. So finally, we want here to promote collaboration between research institutions and local governments. This is one of the key aspects. And also, we want to support projects which are trying to improve data collection and monitoring, but with a focus in vulnerable territories. So this is our approach is mainly participatory, inclusive, and ground level and connected with local realities. This is what we are trying to do.
Fantastic. Thank you, David. Thank you. May I, if I could ask you to tell us a little bit about the work going on in Middle East and North Africa, please.
Thank you, Robert. Good morning, and thank you for being here, and greetings from the team of the Middle East and North Africa Hub for Action Research on Climate Change and Health. This effort is a collaboration between two major faculties at the American University of Beirut, which is the heart of the world. So what do we have? We have the Environmental Health Department, we have the Knowledge to Policy Center, we have the Center for Research on Population and Health, and we collaborate with the Nature Conservation Center. So it's very critical for us to work together and advance. Now, what are we intending to do as such? So our main vision is to advance environmentally sustainable and climate resilient. The sustainability, environmental sustainability is very critical for the climate resilience of primary health care. Why are we worried about the MENA region? Why is it special? What's special about MENA region in terms of vulnerability? You know, published studies till now have shown that a 4 degrees increase in temperature by the year 2070, 2100 is twice the global average. Additionally, a 2 degrees scenario will impact the water resources, the freshwater resources that are available by 15 to 25% in a region which is the most water scarce in the world. Moreover, we have around 34 port cities that will be at risk. Additionally, this is going to impact the GDP, and losses may increase from 2% to up to 14%. This worries us in terms of also heat waves and enhanced heat waves, especially in the Gulf region, that may exceed 53 degrees centigrade. So all this will impact the food security. So what can we do? Dependence on the climate-sensitive type of agriculture, in addition to the twinkling water resources. Already, we're going to lose more. So, moreover, you have the issue of migration in the region, which will be boosted by droughts, floods, desertification, leading to loss of livelihoods and firing more conflicts that we don't need. So as such, what do we want to do? We want to reduce the climate health risk. We want to enhance the resilience, preparedness, response, and recovery of health systems. Now, how did we identify the research priorities in the region? We tried to follow a systematic approach which has many components. So, parallel, we were conducting a scoping review where we identified at least 14 major themes on climate and health. We conducted a survey that was directed to policymakers, academicians, experts in the field, research centers. Moreover, we interviewed all focal points on health and climate change as part of the UNDP program and WHO SIHA that were very supportive. And finally, we conducted like a regional priority setting exercise to rank the priorities. We superimposed all this data that we collected, and we decided as a first step to rank two themes. The first theme relating to vulnerability to climate change, and we want to evaluate the level of preparedness, which is very critical and important. And it's across countries. You cannot say that high-income countries in the region are more prepared than the middle or lower-income countries. So, looking also at this table, you see that everything that relates to emergency preparedness, issues of resilience, issues of response and recovery are minimally published. When we come to the second theme, we want to enhance and empower the primary health care sector to become more resilient in terms of 4 major components: the workforce, in terms of energy efficiency, WASH, management of healthcare waste, and anything that relates to processes, technologies throughout the chain of supply. And this is very important, and lessons learned from COVID-19. So looking at the table also, you see that no studies have been published. Anything in relation to primary healthcare is not there, it's not in existence. So you see from the colors. The only things relating to vulnerability that are boosted by studies from 4 countries. And these are, we have the Iran, we have Pakistan, we have Saudi Arabia, and Egypt. And mostly the impacts in terms of climate change are focused on studying certain types of disease patterns that are climate sensitive and specific to these countries. So this is what we have for our first phase now. And we have launched the call for the research last week. Thank you.
Thank you, ma'am.
Oh, you have yours.
Frederick, please take us to Africa.
Thank you so much, Rob. Good morning, everyone. It's definitely a pleasure to be here. We are in this together. So I represent Chinova, which is the Climate and Health Innovation Hub for West and Central Africa. Chinova consists of a consortium of 4 members. First is the Association of African Universities, which is a member organization of 500 universities across the continent. Then we also have the West Africa Science Service Center for Climate Change and Adapted Land Use, which is domiciled in Burkina Faso. And then we have Institut Pasteur. Institut Pasteur is global. There are a number of Institut Pasteurs, but this one is the Institut Pasteur located in Côte d'Ivoire. And then in Central Africa, we have University Omar Bongo, which is in Gabon. Now, you can see that our consortium then is composed of organizations both in West and Central Africa. And this also reflects the diversity of these 2 key regions. First of all, we know that Africa is the youngest continent. And 60% of the population of Africa is less than the age of 25. And this is very important for us to note. Now, when it comes to our focus in West and Central Africa, there are about 17 countries that Chinova covers. And you look at, for instance, the Congo Basin, where you have Gabon, you also have DR Congo, and then Congo-Brazzaville. These are areas that have agroecological systems based on forest. So you have disease outbreaks that are linked to the environment in those domains. You remember Ebola back then and what happened in those particular areas. Then when you come to the west and then up in the Sahel, which is part also of West Africa, let's take, for instance, Niger, Chad, Mali. These are arid environments where we see a lot of dry ecosystems and environments that last for so long. Now, if we look at these 2 extremes, for instance, related to forest ecosystems and then arid environments. For forest ecosystems, you have a lot of floods, and then for the arid environments, you have drought. Increasingly, we've seen that in the past decade, in terms of frequency, magnitude, and geographical distribution of floods and drought, these are the 2 extremes. This has magnified. And this, for us, poses significant challenges. For instance, in 2024, there was widespread flooding in West and Central Africa, which actually affected over 4 million people. destroyed more than 300 houses and displaced even more than 500,000 people. It even claimed more than 1,000 lives. Now, if you go to households in this environment, the density is very high. So if you have a household, you can have 12, 15 people nested there. So when any climate event ensues, the impact is staggering. We also see that some of these environmental challenges have feedbacks to health. Flooding, we know, is linked to contamination of water bodies, drinking water sources in most rural communities. We have an estimated 80,000 children that are at high risk of cholera, and we saw cholera outbreaks across 12 countries in West and Central Africa, particularly during the raining and the flood seasons. Now, we also see another major challenge in West and Central Africa relating to children. They are present and they are future. They are among the most exposed in the world when it comes to climate risk. And we know that in terms of the proportion of their population to the global population is just about 11%, but when it comes to the impact, it is 33%, which is threefold magnitude of global under 5 deaths. And this is something that Chinova really wants to address and respond to. There are a plethora of solutions that we have co-created with our constituents. And when I say our constituents or stakeholders, I'm talking about 5 key domains. We have policymakers in government. We have civil society, faith-based organizations, community-based organizations, NGOs. They're also part of that. We have communities that are at most affected when it comes to the environmental impacts and the health impacts. And then we also have the private sector. So these 5 key stakeholders were involved in our consultation to really delineate the key climate and health challenges in West and Central Africa. We also did a situational analysis, and then through the situational analysis came out with a plethora of issues. But here I will talk about 3. And then we look at responses that are most impactful. We talk about hosting regional innovation forums. The aim is to connect researchers, community groups, public health officials, government agencies, and then tech developers, because we know that there's also a burgeoning community on the continent looking for time-tested solutions and then frugal innovations that are cost-effective. So we are thinking of doing that, and this is one of our proposed responses. Then also, we have launched a regional climate and health data portal, which is open source. This integrates climate, disease, and health system vulnerability data. One of the things we've seen when it comes to data is the quality of the data. It's a challenge. Some of the data is very coarse, sometimes so amorphous that it's difficult to use. So we are looking at how to really tailor the data to meet specific population subgroups. So we disaggregate the data by gender, by age, by geography, so that the policy responses will be tailored to these population subgroups. And we believe that that would make it much more impactful. Then finally, we also have developed AI-powered early warning systems or dashboards. This integrates meteorological health surveillance data, environmental data, that helps us to really anticipate disease outbreaks, malaria, cholera, dengue. We've done that in Cote d'Ivoire, Burkina Faso, Cameroon, and Ghana. And I believe some of these initiatives that we have deployed is helping us to really be impactful. Thank you.
Thank you, Frederick. Fantastic, fantastic. Martin, please tell us a bit about your work in East and Southern Africa.
Yeah, thank you, and good morning, everyone. My name is Martin, and I'm here to introduce ISA. ISA is East and Southern Africa research hub on climate change and health. We are a unique coalition, a coalition of partners, universities, NGOs. I come from Amref Health Africa, which is the largest health NGO in Africa. We do have KPMG as a private partner. And then we have universities like University of Botswana that is hosting the largest Climate Change and Health Network, called the Chance Network, and lastly, the Africa International University, which prides itself with what we call citizen science. Now, from a geographical perspective, we are working all the way from the north of Africa, that is Ethiopia, Somalia, coming all the way down to the Cape of Good Hope, that is South Africa. And as you can see, this is what is the real sub-Sahara Africa. It's a place where all those challenges that we are speaking about actually thrive. Yeah, and just the other day, you remember Cyclone Friendly in Malawi. It killed 4,000 people. Remember the drought of the Horn of Africa, which killed a lot of people in Somalia, simply because of lack of food. So our vision is very simple. We are a hub. We are a network of researchers and all those entities that are going to facilitate access to data, access to information about what is scalable, what is doable in this space of climate change and health. And so to begin with, we began by conducting a quick landscape analysis, asking ourselves, what is it that we really should focus on? And I'll just speak about 3 of the key issues that came about. The first element was the lack of data or weak data and information that can help the health system to actually plan itself to respond to this challenge. And this was very clear, and it's also very clear that when we are looking at Africa, only 3% of the information and publications that are out there on climate change and health comes from Africa. So you can see the domino gap which is existing there. And when you look at it from the primary healthcare system, you would want to look at that healthcare provider at the health center. Do they have that information? That is not happening right now. Then the second element which came out clearly was the lack of information and evidence about the cost of action and inaction. So that means a problem when we are trying to convince a policymaker to put a budget trying to address the challenges that we are talking about. And so this came out very clearly in our engagement. Then the last piece which came out very strongly is that the workforce which is out there, the healthcare workforce, is largely illiterate. Leave alone the fact that they are not enough. So the issue around the calculation, both for pre-service health workforce and the in-service health workforce came out very clearly. So now, as a hub, what have we invited ourselves to do? 4 main things. And without repeating again, we want to make sure that data systems are strengthened. And they are strengthened from the primary healthcare systems where a person who is at the health center can be able to appreciate the data that is coming from them, can be able to transmit it to the national level. And the national level, regional level, group level are able to use that data for the purpose of planning. Then the second element, this is not enough if we don't influence the policies effectively at all levels. If we don't advocate and speak about it in a way that that information is consumed, then it will not work. So we have invited ourselves to be very deep in terms of policy and advocacy. And next week, we are holding the second Pan-African Conference on Climate Change and Health in Nairobi. You are welcome. We are doing it together with the Africa CDC, WHO, Afro, all those multilaterals are there. Then the third piece is around the health workforce. We want a capacitated health workforce to produce, consume evidence, speak about scalable solutions at the lowest level. And lastly, we know without innovations of processes, systems, then we will not be as efficient. So when we are talking about developing systems that are able to transmit, analyze, develop insights quickly, and accelerate the progress towards producing solutions, we will be doing that. Thank you so much.
Thank you, Martin. Thank you. That's fantastic. Brilliant tour de force of the world. Thank you. And I just wanted to reflect one point that I think is kind of critical. Each of you spoke to some degree about the rigorous, systematic approaches you took to identifying priorities in the climate and health space in your particular region. And it's been a lot of work to set those priorities. And the result now is that as hubs, you're doing research and learning on those topics, but you have open calls for proposals for researchers to come to you to work on those areas from across the entire region. So it's not just centralized in your own institutions. And I think that's an inspiring way to bring new ideas, new people into this system and building a field, in a sense, in climate and health research based in the region and for the regions. I think that's amazing, amazing work. After the introductions to what you're doing in each of your sessions, I thought we could have a conversation really inspired by what you hope we can accomplish working together on this critical challenge of our times, where you see potential in this model that we've developed and how we've begun to work together, and some of the expectations you have for how we can make a difference in this climate and health space. So Martin, maybe I'll ask you to begin and point out a few of the strengths you see in the work we're doing. Thank you.
Yeah, sure. Thanks, Robert. So one of my friends asked me, you already know the problem about the impacts of climate change and health. We are talking about cholera and droughts and floods. And he was asking, why then are you conducting research? Why are you forming research hubs? And if you pick anyone here again, they will agree with that conversation that it's a major problem. But then, if you try to quantify that major problem in a way that it can be consumed from a scientific perspective, that's where we have a problem. Okay? So, the ARCH initiative has invited itself to solve that major challenge of trying to quantify the problem, trying to validate solutions that then can be applied in different contexts, the ones which normally work, which can work in different areas, and the ones which don't work in other areas. But then, the three most important things that I would want to bring to your attention is that when you are trying to engage an investor, and you are trying to ask for resources to drive a particular initiative, it becomes very difficult for them to convince them to give you the resources or to develop an investment case if you don't have authentic data. So the ARCH initiative is going to facilitate a process where we are bringing forward the evidence data to facilitate the development of proper investment cases in climate change and health. And for those of you who have been investing themselves in Green Climate Fund and such kind of mechanisms, you know Green Climate Fund will always ask you about what is the climate rationale, what is the health rationale. They need that evidence for proper investment cases. So that's point number one. For those of you who have been involved in policy development, either at national level, global level, whatever level, you realize that you have to have evidence of why you are arguing for a particular narrative. I've been involved in UNFCCC processes. And for the health sector, it's been so difficult to get a narrative to the negotiation stage. And it's largely because the evidence that we are presenting in those negotiation tables are not strong enough. So the second point is data and information for effective policy imperatives. Then the third element, why we are actually talking about this is, if you want to make sure that national plans, if you want to make sure that the health workforce is properly capacitated, if you want to ensure that those who are talking about the work around climate change and health are actually talking about it authentically, then you need that data. So we are very keen to ensure that climate change and health data is available for the health workforce in a way that they can be able to utilize it at the bottom of the pyramid, and at the end of the day, they can also use the same to advocate for investments. They can be able to use it for, responsive purposes. Yeah, so thank you so much. But just really to speak about this more, for ARC, we are a global lab. We are a global laboratory that is inviting itself to innovate through processes, through people, systems, and all that. And I know I had a conversation with Frederick about some of the key things that we can borrow or develop together in Africa for the purpose of making this initiative big and thrive better. Frederick, would you want to reflect about the innovations there that...
Yeah, thank you so much, Martin. So Martin has spoken about the role of research and innovation for policy making and the importance of evidence-informed decision-making. He has spoken about the what, but I will now take the liberty of speaking about the how. So we talk about research innovation to drive data, policy, and legal framework integration. Now, I'll speak to this issue in 5 key domains. The first one is about data integration. If you have data fragmentation, which is what we see in our part of the world and in many parts of the world, that becomes a huge challenge because the data is not interoperable. But we want to make sure that we have interoperable systems that can speak to each other, linking climate and health data to strengthen early warning systems, and to also help us to anticipate and predict disease outbreaks, and ultimately also inform risks planning. This is very important because sometimes we realize that the impact of disaster on health is magnified because of data fragmentation and because we couldn't anticipate and predict and look forward to the kind of responses that are timely and efficacious in that particular sense. So data integration is very important across hierarchies. So data integration, whether vertical or horizontal, very important when it comes to this. And then the second element, which is also very important, is the element of co-creation and integrating policies across the climate and health sectors through living labs. So we are operationalizing a number of living labs, and in our context, a living lab is a research innovation intermediary for impact. So it becomes an ecosystem where multi-sectoral partners converge to share knowledge, to share lessons, to share practical lived experiences on how they have navigated challenges relating to the nexus of climate and health. So this is very important. And then we also realize that if you come to many of the regions where we are working, as we are for ARCH, we are a global team, you realize that some of the issues are context-specific, but they are also cross-cutting issues that transcend borders. And one of the issues that really is important is how to innovate in terms of the way we even craft the policy, frame the issues, and even look at the opportunities for cross-disciplinary learning. So this is very important for us. And we have operationalized living labs in a number of countries in our regions. The third element is the legal framework. We see a lot of policy incoherence, policy asymmetries. We see territorial dominance. Sometimes the agency responsible for addressing health issues is different from the one responsible for addressing environmental and climate issues. And they all want to protect their territory. How do we ensure that we develop policies, frameworks that are novel and that also resonate with a systems-wide transformation approach? This is very important because climate and health transcends disciplines, transcends sectors. And so we need this particular approach to really address that. And then also look at mandates that are flexible, fluid mandates that are not so cast in stone that is not malleable for innovation. We need to really address that when it comes to the legal frameworks. And then it's important to also involve those who are the framers of the regulations when it comes to this particular aspect. Then the fourth domain is institutional coordination. ARCH is supporting innovative platforms and cross-ministerial partnerships. We've seen in our regions that several ministries are working very hard. They are doing fantastic work, but it's like a black box. Nobody sees what they are doing beyond their sector. And we want to really break these silos. The aim is to break these silos and ensure that we are having institutional coordination for that. And then finally, has to do with equity and capacity building. Even before we talk about the impacts of climate change and on health, we must understand that there are pre-existing vulnerabilities that are there. So these climate and health challenges become a layered impact on the existing vulnerability. And this can actually magnify the impact in terms of the adverse outcomes that emanate from that. And we are looking at how we build equity into the capacity building approaches that we are deploying. ACT is doing this to strengthen local capacity, to build a critical mass of people that have a mindset that embraces inclusivity, community-led innovation, and then even for marginalized groups, persons living with disability and other population subgroups, we want to make sure that we are tailoring the funding mechanisms that we have had from our funders, that is UKFCDO and IDRC, to really address their specific needs. Thank you very much. And of course, if you look at all of these 5 key domains that I've alluded to, it's transformative in a sense. But we believe that this is not all. There's more to that. And now, perhaps, I want to ask you, what more beyond this? Thank you.
Thank you, Frederick. What's more is really very important and very critical. We have to implement a model of local intelligent leadership, intellectual leadership. This is very critical in many aspects as it is based on knowledge, wisdom, and critical thinking. So how are we going to approach it? Our main goal for ARCH is that we want to enhance the generation and uptake. So we have 2 major issues here to deal with. Of evidence, which is, first, gender and equity sensitive, to be able, and of high quality, to be able to direct interventions to make the health system more resilient, more prepared for better response and recovery. So, how are we approaching it as hubs? So across the hubs, we've been following plus or minus similar approaches. In terms first of sharing knowledge, this is very important for transparency. So sharing knowledge is very important. So we started with sharing information about the regional hubs. What are the vision, the objectives, the expected outcomes, and outputs as such, to establish that we are there as collaborators. We're not there as competitors as such. We don't want to be isolated and add to the number of units that don't relate to each other. We're here to build for the future, to tackle a very important challenge that faces humanity. When we come to research, and this is very important, we're trying to apply, or we want to apply and will be applying, robust, rigorous, and localized approaches for systematic research applications. And we have many examples were presented when the hubs were exposing what they're doing in terms of the different methodologies we're following, whether these are scoping reviews, whether these are systematic reviews, whether these are surveys, direct contact with policymakers, and so on, to identify the needs within the region. So this is very important for us. And then the hubs, when we're setting the priorities, we were making sure that the priorities that were defined and the way of funding related to the context, and this is very important. So we have to be rooted within the context because we're serving the region. And this systematic approach is very critical in the intellectual leadership. When we come to developing our landscape, so we have developed a landscape of priorities for the region that need to be addressed. As ARCH, we'll be able to address part of these by setting our priorities within the 4 years. And as this hopefully will be sustained, we're open to collaboration with other stakeholders, and this will expand opportunities, and this will ensure that you have sustainability in addressing these important research aspects and moving them from research into actual implementation. When I think I told you that most of us have been launching, 4 of us already have launched the calls for research. So the sub-grantees, we're not going to leave them. We're going to empower the researchers in the region through proper continuous mentorship. And what does this mean? It means that we are going to conduct needs assessment to define the gaps and accordingly conduct training workshops in order to empower, strengthen the capacities, and what's very important is to actually produce evidence-based research by these sub-grantees. And who's better than the experts in the field in the region at the hub to help the researchers navigate through the complexities of the research in each of the regions. So once we have generated this data, it's time for our trip. So we want to translate research into practice, and this is the most exciting part for me. So as hubs, we're going to act as mediators between the researchers within the different countries and the policymakers. We want to enhance moving from actually the generated data to the policy to the practice. Each of the hubs, we have our own plans to do so. For example, I give you an example for Marsh, the MENA region hub. We're planning at the end to have like a forum where we'll get together the researchers, we'll have researchers, policymakers exchange, so that we identify gaps in terms of policies that are needed, direct strategies that are urgent, and most important, legislation that are needed to implement these strategies. So it's action-oriented, and this is the uniqueness of the whole issue. So we're starting with research not for the sake of research, it's research for action. And allow me at the end, learning from each other has been very, very, very useful. Although it's an additional hard work and more hours of meeting, but I think this interaction has been very healthy, and it's a highlight of ARCH, and I'm very happy to be part of the team. Thank you.
Thank you, May. And I completely agree with you that local intellectual leadership is the foundation of the ARCH Global Initiative. But what really makes unique this program is the way as we take the local activities, the local findings, to a global learning process. And of course, for instance, I'm here from Bogota, and I'm sitting with my colleagues from around the world, and we are trying to do most of the things together, trying to work as a group, as a global group. Of course, each hub develops its own knowledge for local needs, for local necessities, but finally we are interconnected. And we are creating spaces for reflection, for exchange, and for collective growth. And Arch Global Initiative, in this, we are learning together. We are sharing insights, we are sharing tools, we are sharing methods, challenges, even mistakes. We are sharing all the mistakes that we are doing in this process is new for everyone. And these kind of elements we are able to apply for our own regions. And there is another key element, and is our commitment with dynamic evaluation. And dynamic evaluation is a continuous process of learning. We are adapting every day. We are taking the lessons that we are finding in the way of doing the everyday work. And it is interesting because it's based on real-time feedback, and we are sharing all these kind of findings. For instance, we have the subgranting process. When we develop the subgranting process, each hub develops its own methodology, the process itself, but we did several activities, including the webinar, when we share our findings, when we share our approaches. And with this exercise, we were able to improve the whole system. So we are not we don't have like a centralized subgranting process, but each hub has its own process, but we learn together and we improve a lot the process of the whole program. So Arch is more than the sum of its parts. We can elevate these findings, the local findings, to a global policies, right? So we don't want to stay only local. So with this collective approach, we are able to influence in projects, in health systems, also in different communities. Because we are trying to combine science, policy, and the community practices. That's very important for us. So if we are able to summarize our activity, our experience in 3 words, we can say we are sharing, dynamic evaluation, and collective learning. So.
Thank you, David. So while you are talking, I'm reflecting myself. How much we learn each other within this 1 year through Zoom meeting, through in-person meeting, workshop, or webinar. Even within 10 minutes, I learned a lot from you guys. And Frederick mentions young continents, and so now I reflect myself, Asian continent is an aging continent. So African is a young continent, and then we are aging continent. Don't take it wrong that I'm saying I'm aging. I'm still denial. So heat waves are there, and the disasters are there. Then, the strategy to priority setting is for pregnancy and young children, for Africa. For us, we need to take care about, older adults as well, because they have, non-communicable diseases, multi-morbidity. Although there is, the same risks, the same exposure, strategy could be different, So that, we are learning, from each other. I also want to echo what May mentioned, we are collaborators, we are not a competitor. I really agree with you. And we are not the regional division. We are a global family to work together, to engage together. Not only our regional hubs, we really want to engage with the stakeholders, policymakers, researchers, and community of practice, in the region, and then it's also globally. And I want to pull, one examples of our Asian regional hubs. And I mentioned during the stakeholders consultation, and our stakeholders rightly mentioned, hey, not only this priority area, we also need to have a long-term plan. Why don't we establish a climate change and health evaluation and response system? Then we didn't reinvent the wheel. We tried to look for the leverage, existing resources, what do we have in the region? And then we found it, health and demographic surveillance site. Maybe some of you who are not familiar with the terminology, so we call it HDSS, Health and Demographic Surveillance Sites. So this is an incredible resource we have. For example, the oldest HDSS is a med lab in Bangladesh. They have been running 60 years. And the youngest HDSS is in the University Gajah Mada, Salaman HDSS in Indonesia. It's 11 years old. Each and every year, the HDSS documents how many baby born, how many people died, what are the causes of death, immigration or migration. Those are incredible resources for the public health. And then freshly out of the ovens, that photo, we have a delegation from HDSS Asia. We had a meeting in Kuala Lumpur in the last week of September, early October. And then we agreed to incorporate climate-sensitive disease inventory and then wearable devices to measure physiological changes, and then some of the devices to measure indoor air pollution and then indoor temperature. And then to install 3D printed low-cost weather station in the region, satellite imaging, so on and so forth. We will cover 900,000 populations in the region. And other areas like Lebanon and the Philippines, and then also the North Borneos are also interested to be a part of this initiative. And go to the Africa. A lot of HDSS sites are in Africa. They cover 3.6 million population. And some of the HDSS, as far as I know, like Nuna from Burkina Faso, Camry from Kenya, they started having climate change and health monitoring there. So I think it is a credible source and then, very good platforms for collaboration. But of course, we need a significant resources and then funding, to establish our big mission. So I want to stress again that we are global open platform and that this is very low-hanging fruits. Everyone can work together. If you are a researcher, and then if your research interest is matched with the regions you belong to, please apply funding from the respective regional hub. If you are students or early career researchers or mid-career researchers, you plan to reinvent yourself to climate change and health, we have a capacity building plan. And then, please check our websites. But I have to admit, some of the websites are not still live. But end of October, all websites, will be live. So please check our website, which kind of capacity building plans, we have. If you are a knowledge user, if you are from media and communication, if you are journalists, if you are policymakers, we can produce evidence for you. Last but not the least, the funders. We really want to invite, funders to top up the existing funding, like, the very good example of Canada IDRC and UK FCGO. Then the existing infrastructure, existing activities can be enhanced, and then we can do a lot more and more. We have already demonstrated what we are capable of doing, so we really invite everyone engagement and collaboration. Thank you so much. Rob.
Thank you, Tintin. Thank you. Thank you all for the remarks. I want to move to a question and answer period with the audience. If you have questions, please prepare them. But I heard 5 key points I just want to reflect on. Martin, research, the necessity of evidence to find the solutions to this imminent and critical challenge of our times. It's so critical that we have the evidence to how we make decisions and where we're going. Frederick, I think you did a really nice exposition of the ways that research can break the silos that are part of the problem in the health systems for addressing climate and health. And I think incredibly important of how we position research to break silos, integrate our responses, and the critical role research will take in that process. I think it was so important, the point you're making about local intellectual leadership. Who is better placed to identify the priorities for each region and to help move the evidence from research findings into practice? Who knows those policymakers? people who have been working in the region at the American University of Beirut for decades. This is a fantastic advantage that you're bringing to this program, so thank you. And David, I think what I really heard resonate from you was this point of the sum being more than the parts. And the commitment that the hubs have made to learning with each other, from each other, and exchanging what you're learning, so that you punch above your weight from making a difference in the region, but bringing that to the global level. And Tintin, I just want to congratulate you on the successes already of being an open platform for the regional hub in Asia. And I want to join you too in that invitation I think you made, which I'd like to open to the room too. We've spent this year building this platform so that it's accessible. If you're a researcher, a student, a funder, a policymaker, we invite you, step onto the platform and join us. This is a critical challenge of our times, probably the greatest one our children are facing. And we'd like to have you be a part of the solution with us. So with that, I'm going to move into a Q&A. And if you've prepared questions, please just raise your hand. And I think, yeah, please, go ahead. Introduce yourself and prepare your question. Thank you very much.
No, thank you. My name is Ricardo Leite. I'm from Portugal, but born in Toronto. I have a contention with our moderator who's from Ottawa, and he supports the Ottawa Senators in hockey. I'm a Maple Leafs fan, but we're united on climate and health. I just want to say, so I'm the founder and president of the Unite Parliamentarians Network for Global Health. And I heard something here that is extremely important, of course, on the importance of evidence of science. And politics is local. And if you want to have global impact, if you want to affect climate and global health, you have to create local levers for change. And that's the only way we're going to get it done. The problem is we're moving into an era where science seems to be more a matter of opinion than of evidence in the political world. Just the other day, I was hearing someone pretty relevant in the vaccination field saying on stage, "I believe vaccines work." And I was thinking, what the hell? I mean, you know vaccines work. It's not a question of belief. I'm Catholic, but come on. I mean, it's not a question of faith. And so we need to be adamant on the importance of the scientific method as the basis of everything we do. And it is our work also engaging with parliamentarians, because the reason that this is arising has many sociological factors behind it that we cannot ignore, and that these hubs cannot ignore. Because it is critical that when we design research, when we design evidence, when we put it out there, we have to be capable of communicating in a way that is transformative, and to also reach out to those that are not in this room, that do not believe in what we are doing, who have a different view, fueled by anger, social media, or whatnot. But what I think these hubs are also doing extremely important, and kudos to IDRC and FCDO for funding this, is also showing the cost of inaction. When addressing policymakers, we're seeing that many times we're always, as a scientific community, saying what you need to do, where you need to invest. But not doing anything is also a political choice with consequences. And we also need to highlight and actually keep our parliamentarians and politicians accountable to when they decide not to act, that is a political choice, it's on them. And that has consequences, and that's also something that the science needs to reflect very clearly. So the Unite Network is, of course, working with IDRC. Very proud to be organizing our summit in Manila, which brings together the parliamentarians from 120 countries, more than 500 legislators in our network. Hopefully, we'll be able to bring on this topic and a lot of the lessons learned from your work. But almost all of you mentioned that at the local level, you are working with policymakers. And so it would be important to hear from you, if I may, how that engagement is happening. And of course, you can always leverage Unite as a partner to make sure that you're engaging also with global health champions in your countries and in your region. One last final point to say that my day job is as CEO of Health AI, the global agency for responsible AI in health, and also the role of artificial intelligence, I believe, is going to be critical in this endeavor, and we're working with governments around the world. Also, feel free to reach out to us, and congratulations for your work. Please keep up the good fight. Thank you.
Thank you very much. Thank you. Profound and important. So maybe I'll go to any responses you'd like to have, and if others had a question, just raise your hand, and there's a microphone moving. So, Tintin, please go ahead first.
Thank you so much for the questions. So, of course, once we talk about, I have 2 points to respond to your questions. Number one is science. So I think not only scientists are making the science, that's my belief. The science is not regression discontinuity analysis. Science is not data simulations. So I really believe, working with the community, because I'm a public health physician. So once we develop the science or evidence, we should be together with the researchers and then the community, people with the lived experience, that will be a true evidence rather than the science. And engagement with the policymakers, what we started doing, for Asian Regional Hub, we will have an advisory committee. So we try to include, each and every representative from ministries, they are working on climate change and health space. And then we identified, 4 or 5 ministries. So we started inviting them, to be part of the advisory committee member. So I find that this is a kind of smart move. And then, we started engaging. Engaging with the policymaker is not at once we see the results, It's from the beginning. And yesterday I launched, 2 new words. I love it. That's a policy literate science and science literate policy. So we will make ourselves, policy literate scientists. And then at the process, we were trying to make policymakers, more science, literate. So that's, our strategy. So hopefully I answer your question.
Thank you, Tintin. May, did you want to respond quickly?
The second part, in terms of how we're engaging with policymakers, is that as part of the survey, we tried to ask the policymakers, what do you think are the priorities? And you'll be amazed when we compared the results of the different surveys, how the priorities are completely different. And when you come to policymakers, they want to address short-term aspects, and that's the end of the story. So the issue of evidence-based research, I think, is so critical to shape our vision, to move ahead. So we're beyond just addressing a problem now and not in a sustainable manner. So I think also this should be part of empowering policymakers and parliamentarians, and I think we're ready to do that if you want.
Thank you, May. Thank you. There's another question here in the back, please.
Yeah, thanks very much. My name is Bettina Menne, and I was the leader between 1997 and 2016 in WHO Regional Office for Europe on Climate Change and Health, and the convening lead also in the IPCC and review editor in the latest cycle of the IPCC. So my questions refers to the Intergovernmental Panel of Climate Change. And congratulations, first of all, for bringing this network together, because we realized there were so few studies we could include from Africa or Asia, et cetera, in the latest cycles of the Intergovernmental Panel of Climate Change. This is super important because it goes to the summary of policymakers, which is then negotiated with the governments of the world. And the stronger health and health in your regions is presented, the stronger action can be taken. But my question is now on research. While I understand you're doing very much near-time research, both on the data, policy inclusion, social, et cetera, so to face the risks you're currently facing, okay, how are you going to deal with scenario studies? What are your efforts in the future scenarios, so the futures, okay? And how are you going to represent this, number one? And number two, when are your studies going to be published. This is super important because in order to get into the next IPCC cycle, it would be good to have a 3 years, 4 years, something outlook. Thanks very much.
No, thank you. Thank you for joining us in the question. I think we should turn to one of our lead authors on the IPCC chapter on climate and health, maybe to say a word.
Exactly. That's a very nice question. And I'm the coordinating lead author for health and well-being. That's chapter 19 of the IPCC report. So that's a very relevant question. So you asked about what we are doing in terms of, predicting the future and all that. I can assure you that is part of the narrative that is going to come from the kind of researches that we are doing. But at the same time, we are not just saying that we wait for, what is going to come out of this team and what is going to be generated by other forums, so to speak. But we are going to begin by, appreciating what is there right now, meta-analysis, looking at around the systematic reviews and all that, and start utilizing it for the construction of the IPCC report. Yeah, so we are lucky, at least we are represented. I can see the health sector for this time round is right at the center of this. And thank you so much, WHO, for the kind of push that you have been giving in this initiative. Yeah, thank you.
Thank you.
Thank you very much for the question. So I'm also happy to indicate that through IDIC and UK FCDU, in terms of scoping the major issues in the various parts of the world, we used future studies and foresight thinking. So we have a foresight lab where we look at a plethora of scenarios. And then one of the key elements that emanated from that discussion is questioning our assumptions, because scenarios are based on assumptions. So we need to look at how assumptions feed into the way we frame the issues and the kind of responses that we try to proffer to address the issues. So I would say, in a nutshell, we took into account foresight and futures in the way we scope the issues. Thank you.
Thank you, Frederick. We're nearing our time, and we're here for more questions and discussion, and the invitation is open. We want to work together, so talk to us. But while we walk away off this stage, I think I would like to give you each one more moment for maybe a takeaway message that you think would be important to share here in Berlin while we have this opportunity together. Maybe Martin, you can begin.
Yeah, thanks, Robert. I can sense that the health sector is seeking some sort of direction. And I would say that data and evidence is the compass that gives that proper direction. And what I would want to say is that the ARCH initiative has that vision. So I'm inviting all of you to join that vision of ensuring that when you are developing policies, then they are guided by evidence and all that. So join us in our vision, and looking forward to working with you all. Thank you.
Thank you, Martin. Frederick.
Yeah. Thank you so much, Rob. Yes, so we know that the health impacts emanating from a changing climate is real. This is something that many of us know, but then we need to move from rhetoric to action, and the time to act is now. Thank you.
Thank you, Frederick. Tintin, would you like to go ahead?
Yeah, so for us, ARCH is not a short-term initiative. So we want to move far, so we have to go together. So let's move together.
Thank you. Thank you, Tintin. David, please.
Okay, true progress happens when knowledge flows from both ways, from policy to people and from people to policy.
Thank you. Thank you.
So I'm inviting you all to embark on this trip, translating research into practice. Thank you.
Thank you, ma'am.
Thank you.
Thank you. Thank you all for being here. It's been a wonderful opportunity. Thank you.